This is the second of 4 films showing local anesthetic injection for wide-awake carpal tunnel and cubital tunnel releases in the same patient. This 8-minute film shows cubital tunnel local anesthetic injection. Are you comfortable in that position?
Yeah.
Can you bring your elbow up just a little more? Sorry.
Well,
yeah, just like that. Is that uncomfortable?
Not a bit.
Not a bit. Okay. Beautiful. So what we're going to do here, I'm going to go the most proximal place that I'm likely to go, which is right there. So don't move, don't move, don't move. Ouch, sorry for the sting. Once again, blow just a little bit underneath the dermis, and then pause. Let the local anesthesia work so that it doesn't hurt when I move the needle around. Is that hurting at all there now?
A bit.
Okay. And then we're going to just stay parked right there because I know my needle is in a safe zone. And I'm slowly going to inject here. Is that hurting at all?
No.
And the whole idea is to be slow, be patient. And you know, some people think, well, I'm going to waste time doing that. Well, you know, it took me a total of 5 minutes to do the carpal tunnel injection. It'll take a total of about 5 minutes to do the ulnar nerve injection. That's 10 minutes. So talk to me about operating room turnover time and how much time that takes people. So far I've put in about 3 or 4 cc's right there and I haven't moved at all. Has that hurt at all? No. So now I can start moving my needle because I've got a safe zone to work in. And I'm going to re-aim it so that it's just below the dermis. And I'm going to blow slow before you go. That's the whole key. And we're continuing to use 0.5% with 1 in 200,000 lidocaine with epinephrine because we're doing both the elbow and the carpal tunnel. In this, it's worth pointing out again about the pH. The normal pH of lidocaine with epinephrine is 3.3 to 5.5. That's a range if you actually read the label on the bottle. And if you add 1 cc of bicarbonate, 8.4%, which is only $4 a bottle and available in every hospital, you change the pH to 7.4. And of course, that's 1,000 times less acidic than what the bottle is, which is why, as I inject this, as long as I go slow, it's not hurting this gentleman. So now I'm going to go right here because I know that that should be a safe zone. He's going to tell me if it is. Did that hurt at all? Okay.
No.
So far, how are we doing up here in the elbow? The first poke, or did you feel any other pains?
No, that's the first little poke. I wasn't mad either.
Oh, that's good. And it shouldn't be bad because it's a 27 gauge needle.
Yeah.
So it's a pretty small needle. You know, it's
Sharp point.
A sharp point, pretty small needle. The big issue here is, or the big important point is big volume.
Yeah.
Big volume, lots of time, no rush, and blow slow before you go. I like to get at least 40 cc's up in the elbow, and so far I've put in about 10. And then another key, of course, is to give it time to work. And so we inject these patients well ahead of the surgery, and you can inject them on a stretcher outside of the main operating room if that's what you choose to do. In the last few years, we've stopped doing our ulnar nerves in the main operating room. For one thing, we're not transposing them nearly as often, although you could still transpose them with field sterility. But 70% of Canadian carpal tunnels are now done with field sterility outside of the main operating room. That means just with 4 towels and a hole in it. And there's been no increase in the infection rates in Canadian carpal tunnels. And that's why most people are doing that today. And now we've started doing the same type of thing with the ulnar nerve, because the ulnar nerve is such a short operation, especially since we've stopped transposing most of them. The only time I would transpose an ulnar nerve now is with active movement after we release the nerve. If the nerve was subluxating out cubital tunnel, in that circumstance, I would go ahead and transpose it. I just tack a suture, do a subcutaneous transposition. So that's 20 cc's in the elbow so far, so we're going to put in the second 20. This is also 0.5% with 1 in 200,000 epinephrine. Did you feel that little needle?
No.
So far, just the first poke, right?
Yeah.
And we hope that that's how we continue. That's called a hole-in-one local anesthetic. If the patient just feels the first poke, if they only feel pain once, that's a hole-in-one. If they feel pain twice, that is an eagle. If they feel pain 3 times, that's a birdie. And most of our medical students and residents, after they watch one of these, they go ahead and do the next one, and most of them are able to get at least an eagle, and most of them actually do get a hole-in-one. And I'm not a golfer. This is as close to golf as I get, but every time I put in a local anesthetic, I do score myself, because I think that we can always get better. My goal is to get a hole-in-one every time I do it. So far, we're winning on this gentleman's carpal tunnel and on his ulnar nerve. But he's going to tell me. We're not going to do any lying here. Could you extend your arm just a little bit more? Beautiful. Just to loosen up that skin right over the cubital tunnel. Another important point here is to just give the local time to work. I've had over 30 digital blocks myself, and every time that I have one, it's amazing to me that the intensity of the anesthesia increases over half an hour after you put the anesthetic in. Did you feel that? No, good. I was just going just a tad fast there, and I might have got the needle a little close to the white edge of the inflated local. I think you can pretty well see where I am. Always have at least 5 or 6 millimeters of local anesthesia ahead of the needle. Did you feel that?
No.
Good.
You're doing pretty good.
So far we're doing okay, huh?
Yeah.
I don't have to go back to medical school just yet? Okay.
Not today.
Well, if people get a bogey or a double bogey, they go back to medical school. That's when you feel pain 5 or 6 times. And in fairness, in the old days when I just used to blast in local, as I was taught to do, people would always get pain 4 or 5 or 6 times, but just not necessary to have. So that's the end of it. That's 40 cc's of 0.5%, and I'd be happy to put in more if we needed to, but I think that's probably going to be it. So if you just shoot his face, please. So I want you to tell me how many times you felt pain in your elbow there.
I never felt pain. I just felt the needle a couple of times going.
Oh, you felt it more than once?
Just the once.
Oh, just once?
Just the once, yeah, the needle, the very first time.
Right, and that was it?
That's it.
Okay. I need to know the truth now. You didn't feel 2 pokes?
No.
Okay.
No.
Okay. To see the surgeries of the wide-awake carpal tunnel and cubital tunnel operations, please see movies 3 and